See, why research is important? The only thing that comes to my mind is necessity. As we know that necessity is the mother of invention. So whenever we need something in any aspect, we try to find out, try to experiment, try to search and research, and what has come out at the end is to make our life more better, more easier, and more healthier, I can say. So this is how the, if general terms, if I'll explain what research is. Now, now I will explain you the research when when you look at our surrounding. I told you about research. When we look into ourselves, to this human body, the research related to our human body is called as biomedical research or medical research. So now if you compare that research which with respect to inanimate objects, which they don't have life, how important it is to make our life more better. Now something which is the research related to our diseases or our health problems is in a broad term called as medical research. And medical research can start from one developing one instrument to one drug to one molecule to one gadgets to one test, anything comes under this biomedical research. Now, as we know, with passage of time, the types of diseases, the number of diseases, the number of patients are just going, like it is increasing day by day, the number is increasing, I can say, in a geometric progression. So, and in what is the recent research is telling, in the future, in the upcoming years, the most common disease which the world will face is cancer. And as we know, cancer can affect it can affect any part of the body. And cancer, as we know, it is just an uncontrolled, unregulated way of same cells in our body which will divide in a very uncontrollable and unregulated way. And for many cancers, we do not know what is the cause. We do not know what is the treatment. We do not know how early we can pick up them. We don't know how to prevent them. So thereby, these are the areas that I spoke where cancer, if you do research more on cancers and cancer, we will pick it up. Then what will be the result? The result will be either we can prevent it before it comes to us, either we can treat it, or we can completely cure it, or we can have many molecules, at least we can control it. So for cure, for prevention, for treatment, for controlling it, we need either good surgery or good gadgets to do surgery, or new molecules which have minimum side effects. We know that chemo drugs have so many side effects. If we could have listened to our patients or our relatives or our brother, sister, if any would have suffered through any kind of cancers, we know how the treatments are toxic. So we need more and more research on these cancers, so that the more the molecules, the recent things will come which will make our suffering to the minimum and make our drug which are given to us will be more effective. So these I told about cancer research in general. Then coming to gynecological cancer research. So gynae cancer, as you know, the cancers which are mainly limited to the reproductive organs of the female, may it be cervix, may it be ovary, may it be a uterus, may it be vulva, the vagina. So these are the parts of the female reproductive organs where cancer can come anywhere. And why in particular I am highlighting about gynecological cancers? Because mostly we know, or we all of us aware of that, how the importance of a mother or a sister or a wife in our life, how they are important for our family in particular and for the society in general. So their health should always be optimum. They should be disease free at any cost, which will make the society healthy, the family healthy, in a large the world healthy. So in gynae cancers, in our institute, a lot of projects are going on with respect to cervical cancer, ovarian cancer, endometrial cancer, breast cancer. And if you look at the Indian data, the most common cancer in females is breast. Then the second most gynecological cancer is cervix. Third most common is ovary. And if I will tell particularly about breast cancers and cervical cancers, and they are preventable to a large extent. So, the main thing of highlighting this point is, the main thing that is lacking in us is awareness. We do not know that research is going on in premier institutes where cancer patients are getting treated. So, I will be requesting wherever we are sitting with anyone who are suffering from any kind of cancers, when they are visiting to their respective consultants, cancer specialists, just to ask a question whether, sir, whether any research where I can be benefited. So, whatever this biomedical research, as I told, it involves human subjects. So, the treatment that we give have many side effects, and whatever drug at present we are using, they all goes through a different phases of research. They starts with animals, then gradually they will go to limited number of healthy individuals to see how the drug works. Then they will test the same drug in a greater number of bigger number of individuals to see what is the minimum dose that can be given, what is the maximum dose that can be tolerated for that particular. Then finally they will try that particular molecule on a cancer patients. So, as you know, these molecules will have some of the other side effects on our body, but when we don't have any treatment available to us at present, if a molecule which is developed in laboratory and been tried in animals and healthy individuals and certain group of patients, if we are getting part of the trial, then what are the benefit we are going to get? You will be asking me what benefit I will get if I will be part of the research. So, I will be telling, if suppose I am a cancer patient, I am getting enrolled in a particular research, nobody is going to enroll us without our consent. With my consent only, I will be part of the study, and any point of time I can be out of the research project whenever I feel I don't want to continue. That whole autonomy is there with me. Third thing, the benefit that I am going to tell you is a treatment when this is not available in our country or in our area. If I am part of the research, that particular research molecule which is available, which is maybe invented or discovered in abroad, will be accessible to me. Second thing, the cost will be either it will be free of cost or the cost will be significantly reduced. Third thing, the complications that I will face from that particular treatment will be taken care of by the research company who is conducting the research. So, this way I will be personally benefited by a new drug, by my less of complications or less of more healthier or disease free life, and by and large my contribution will add to the science, which will in future will benefit a huge number of patients. Many that what I am enjoying today, what treatment we are getting today, is because many has sacrificed or many have contributed or many have consented for that particular research at some point time back in past years, and now it is our time to help the science to progress. So, at the end, just one line, I will be just one sentence I want to tell and conclude my talk is, just be aware that research is an important part, particularly in biomedical research, if I speak specifically with respect to cancers, because it is just booming up like an epidemic. And whenever we see or we encounter any cancer patients or in our family or in our surrounding, just educate them that if you think whenever you are going next to meet your cancer specialist, just ask whether madam I am eligible for any kind of cancer research, please explain me. This I in my talk. Sarve bhavantu sukhinah.